while we are rightly focusing much of our nation's energy on coronavirus, this is not the only health crisis we are battling. Unfortunately, across the nation, drug overdose deaths are rising among the coronavirus, negating much of the progress that we made over the last several years.
Dear Brian.
Dear Greg.
Michael Honey.
From the moment you were born, you were the sweetest kid.
You brought us such joy and happiness. Thank you for those 29 years.
We have a vision that our society will look this disease straight in the eye, prevent it and treat it with love and empathy, and with protocols based on science. We are coming together to increase awareness and funding for the prevention, treatment, and recovery of this disease.
I'm repelling from my son, Paul.
I'm repelling from my dad.
I'm repelling from my sister-in-law.
That was awesome!
Go Shatterproof!
Go Shatterproof!
We are here for friends. We are here for family. We are here for community. And we are here to bring the disease of addiction out of the darkness and into the light.
We are Shatterproof!
My older son, Brian, struggled with addiction for 8 years. And during that time, he went to 8 different treatment programs.
Shatterproof is currently developing public databases in multiple states that, if successful, will allow the public to identify, evaluate, and compare substance use treatment programs.
I would like to extend my appreciation to President Bill Clinton, Chelsea Clinton, and their Health Matters initiative.
I'm very grateful to be here today at a critical time to talk about why we must tackle this issue and what Congress must do to tackle this issue.
We need to start treating people in this country, not jailing them. We need to give them the tools they need to recover, because every life is precious. Every life is an individual gift from God. And we have to stop judging and start getting them the tools they need to get better.
I don't think about this issue as a public official or as a healthcare guy. I think about it as a father. I've talked to people who've been in the middle of this, and they're among the grittiest and gutsiest people I've ever met. And they deserve our respect and our love and our support.
Let's create that world that Brian didn't see. Let's create that world for the next young man that comes along, the next young woman that comes along, the next family. Let's drag addiction out of the shadows and into our hearts. I can't imagine a more perfect expression of humanity. Thank you.
Hey everyone, thank you so much for joining us this evening. I'm Craig Melvin of NBC's Today's Show. Frankly, this is a little late for me to be up, but I would not have missed the opportunity to be with you in support of Shatterproof, the leading organization in this country, which is fighting to eliminate the devastation caused by addiction in this country, a problem that, as you know, has only gotten worse with this COVID pandemic. I'm sad to report that the number of opioid overdoses in America up a whopping 42% over this time last year. So the twin epidemics of addiction and coronavirus have joined to create this horrifyingly perfect storm for millions of people in this country. So I know for many of you with us tonight, this isn't just a national issue. It is a very personal one. Your son, your daughter, your parent, your spouse, your friend, someone close to you lost to substance use disorder, or they're struggling with it. Tonight, Or perhaps they're in recovery and striving to find the best treatment to stay that way. That is how I discovered your organization, Shatterproof, and its founder, Gary Mendel, who was able to lend a hand to me and my family in a time of need. And as probably most of you know, Gary suffered a parent's worst nightmare 9 years ago tonight. Gary lost his son to a disease, and he later learned it could have been prevented. Just think about that. Not only is Brian Mendel gone, but he didn't have to be. Instead of living in the past, of dwelling on if only, Gary turned his life around to make sure this wouldn't happen to another parent, another family, another loved one. Shatterproof's goal is better treatment, better laws, and better information about the disease of addiction. As you saw up top, Gary's worked tirelessly and relentlessly, telling a story along the way, which really drives the issue home. Ladies and gentlemen, Gary Mendel.
My name is Gary Mendel, and this is my son, Brian. And this afternoon, I'd like to tell you a story of two boys who were growing up in Easton, Connecticut. It's a small town where I was raising my family. The year is 2004, and both boys were entering high school. The first, Mikey,
was diagnosed with cancer. As you'd expect, his family was devastated. However, they were easily able to access the highest quality medical care, all based on science, proven research. Mikey's parents told their friends about what Mikey was struggling with, and our entire community rallied behind Mikey and his family.
Parents came to their home with cooked meals, drove carpools. Children in our elementary school held bake sales on the weekends to raise money for Mikey and his new charity. And the whole time Mikey was sick, he received all the love and compassion that anyone with a disease could ever dream of. Well, two streets away, my son Brian
was also struggling with the disease. But for Brian and our family, it was so different. We looked for high-quality medical care for our son,
but we couldn't find any that was based on scientific research, as hard as we looked. We were embarrassed to tell our friends about Brian's problem. And our community didn't rally behind our family. No one called to cook meals, drive carpools, no bake sales. And frankly, I didn't want to ask for help. I felt like I was a failure as a father and a failure in my community. The disease my son struggled with was addiction.
And my son Brian struggled valiantly for almost 10 years. But tragically, he lost his life at the age of 25.
I've had the experience that it's every parent's worst nightmare. I buried my son. After my son's death, I was haunted. What could I do to spare another family of this tragedy?
And even more tragic, it wasn't just addiction that took my son's life. It was the feeling of shame that he felt about himself every morning when he opened his eyes. A feeling like an outcast, a disappointment that caused him to wake up that morning.
And the history on his computer shows he started researching suicide notes. The first he researched was Kurt Cobain's. And then he wrote a note of his own. He lit a candle, and he took his life. Alone. I wish I could tell you that my anguish has dulled in time, but it doesn't. But it hasn't. It intensifies with me, knowing that my son died of a disease that is preventable, and we don't prevent. That is treatable, but we don't treat. That is undeniable, and we continually deny.
And ever since that day, I've continually asked myself the same question.
Single question. If both boys had a disease,
Why are these stories so vastly different? Thank you all so very much for joining us this evening. I deeply appreciate it. I'd like to extend a special thanks to Craig, to United States Surgeon General Adams, to David Solomon of Goldman Sachs, and a heartfelt thank you to singer-songwriter Sarah Mclaughlin, and all those participating in our program tonight. After Brian's death, I began to research what could be done to spare other families the tragedy my family had suffered. And as I did so, a vision emerged of uniting millions of Americans and empowering them to create change. And from this, our organization, Shatterproof, was born. I miss my son terribly. I come here to his room often to be with him. However, in many respects, I feel blessed. I've had the opportunity to meet so many wonderful people all across our country. Hundreds of thousands have joined our cause, and together, we are making our vision a reality. We are the leading organization in our country fighting addiction through changes in public policies, influencing 3 federal laws and legislation enacted in 18 states for the safer prescribing of dangerous opioids, greater access to a medication which can instantly reverse an overdose, required education for physicians on the prevention and treatment of addiction, and innovative payment models to incentivize scientifically proven, high-quality care. We also created our nation's first evidence-based and broadly accepted national standard of care for the treatment of addiction. We then launched our nation's first quality measurement system, which evaluates treatment programs by their adherence to our national standard of care and their outcomes. Plus, a groundbreaking agreement with the largest insurers in our country to only pay for addiction treatment that is shown through science and data to work. And we also developed a highly curated educational module, Just 5, that is already being provided to hundreds of thousands of families through several of the largest employers and healthcare systems in our country. However, we can do more. We must do more. That is why 3 months ago, with the help of consulting firm McKinsey, we launched a national movement to end, once and for all, the stigma and judgment associated with those afflicted with this disease and their families. If we as a society can change the way we think about this disease, more people will feel loved and connected. Fewer will die, leaving families shattered beyond any repair, as has mine. Which brings me back to my son, Brian. Brian didn't see a world where he could be looked at as normal. As a young man who got sick, needed medical treatment, and then could get better and live a full and fulfilling life. I can't live without trying everything I can to create that world for the next young adult who comes along and the next family. Together, we can make this happen. I thank all of you from the bottom of my heart for joining us, supporting our work, and for getting the word out that change is coming, because it is coming, and many lives will be saved. Thank you.
We refuse to remain in silence. We walk, we run, we fight, and today we speak. We speak their names and the name of their disease. We hold them in our hearts, and Shatterproof holds in our hearts each of you here today, because each of you are the backbone, the heartbeat of a movement that is going to end addiction in our lifetimes.
Gary, I know how hard this is for you, but I want to sincerely thank you for making efforts to turn the tragedy of losing your son, Brian, into hope for so many others, because that's truly the way we can honor Brian's legacy and really turn your loss into something that can lift up other people all across the country. And so I just I want to thank you. Every time we talk about it, it doesn't get any easier, but it really impresses upon me the importance of us staying the course. Quite frankly, thanks to your efforts and your partnership, we have saved tens of thousands of lives. As many of you have heard me speak about in the past, I'm passionate about this because for me and my family, as for Gary, the opioid crisis isn't just pressing, but it's deeply personal. My baby brother, Philip, recently finished serving prison time for crimes committed to support his addiction. Philip suffered and continues to suffer from mental illnesses and conditions, but unfortunately, for years, they were untreated. And he turned to an array of substances to self-medicate. I share my family's struggle to illustrate that addiction can happen to anyone in any family, even the family and the brother of the United States Surgeon General. I share my story in the hope that it gives others the courage to share theirs so that together we can fight stigma. Because there are far too many people who look around and say, well, this can't happen to doctors. This can't happen to successful business owners like Gary. Addiction can happen to any one of us and any one of our families. And I truly believe stigma is one of our biggest killers. It kills as many people as cigarettes. It kills as many people as sugar-sweetened drinks. It kills as many people as any other risk factor out there. And unless our loved ones and our families feel comfortable seeking help, we will never be able to reach those who need it the most. I want to note, as an African-American male, that in my experience, stigma is particularly apparent in communities of color and in rural communities like the one I grew up in. And it's no coincidence that these are the same communities that are being hardest hit in many cases by substance misuse. And it's not a coincidence that these same communities have also been particularly hard hit by the COVID-19 pandemic. We know the reasons are many, and they're rooted both in pre-existing medical as well as social conditions that conspire to reduce resilience, opportunity, and health. And COVID-19 is exploiting and exacerbating these pre-existing health disparities, including substance use disorders. According to a recent issue brief released by the American Medical Association, we know more than 30 states have reported increases in opioid-related mortality coincident with the COVID-19 epidemic. In order to address this, an essential component of any plan must be governors, legislatures, local policymakers, and communities supporting safe access to high-quality addiction treatment programs.
Addiction is a treatable chronic disease like diabetes or asthma. And similar to other diseases, personalized addiction treatment based on science is shown to help people manage their disease and enter recovery. But you may not know what type of treatment you need, and searching for quality care can be overwhelming. When faced with misleading advertisements and other confusing information, it's hard to know who to trust and what treatment works best. The national nonprofit Shatterproof has created Atlas to help you navigate to the care that meets your specific needs.
This kind of database and transparency is the type of information that American families deserve to have, and they deserve to have it now.
When you're ready to search, you can use Atlas to sort through addiction treatment by factors important to you, like location, services, and insurance and payment options. Experts agree that certain practices should be used when treating addiction. Atlas displays information on whether facilities offer these best practices. We also make it easy for patients to leave feedback on their experiences at the facilities and display this information to support your care decision. As you explore options, compare up to 3 facilities side by side to help choose treatment that is best for you.
Among many others, I lost 3 of my friends to overdose, all from the same sober living in the San Fernando Valley. And now I think, what if they had some access to something like Atlas in 2014? It's not a new idea. Shatterproof is finally doing it, and they're doing it right. I imagine my departed friends having had a universal starting point, one they might have used to pinpoint a path to true recovery, and they might still be here. We've got to stop losing people this way, and we are going to stop losing people this way, and Atlas is absolutely going to help.
At Shatterproof, our goal is to help you find care that best meets your needs and leads to improved health and long-term recovery. We are also invested in supporting the addiction treatment system in aligning with these best practices. Ultimately, this will save lives.
Atlas is the first resource of its kind to help those seeking addiction treatments, helps them to find high-quality care and appropriate care. It was launched in 6 states. I'm happy to say West Virginia was one of them, with the hopes expanding it to many more.
In a recent poll, 44% of Americans said it's their fault, they're not trying hard enough. Roughly half the country. And half the country said it's not their fault, they developed a chronic illness. To me, that's not that relevant whose fault it is. What's really relevant, to me, it doesn't matter to me, the research shows that's not that relevant. What's really relevant is 80% of Americans said it doesn't matter whose fault it is, I am not willing to associate with someone as a friend, a coworker, or a neighbor. Why did my son take his life? He was successfully treated. He hadn't used a substance in 13 months, but he lived in a society where he didn't read some survey. He felt and lived that survey. And it's not my son, it's millions of Americans, whether it's opioids or alcohol, feeling like you can't. No one wants to be your friend, your coworker, neighbor. Date your daughter, date your son, be in the same Little League team, or coach a soccer team with your son or daughter. It's not Little League, they're too young, but that's, you get my point. And if you have every company in America sharing stories once a year, twice a year, where someone gets on a webcast for 15 minutes a year, or twice a year at a company, and says, hi, I work for this major company, or any company, like all of you. I've been here 10 years. I've been promoted 3 times. I'm married with 3 kids. I coach Little League. I go to church on Sunday mornings with my family. And I'm addicted to heroin for the last 4 years. And 10 of you on this call, I play tennis with every Tuesday night. And you didn't know. And 3 of you on this call, I carpool with every morning. We live in the same neighborhood. You never knew. We have neighborhood barbecues. 200 of you on this call, I've been working in the same office on the same floor for the last 5 years. You didn't know. I got promoted 4 times. That's what addiction looks like when treated with evidence-based treatment. That's what worked with marriage equality. That's what worked with HIV/AIDS. That's what will work with this.
Well, there you have it. That's what stigma looks like and how we can get rid of it. Stigma's everywhere, and we need to join together to make it nowhere. So let's change the paradigm. Let's change the conversation about the disease of addiction. Shatterproof, forging ahead with this work, pandemic or not. There's nothing more important than turning the stories of devastation into stories of triumph, of ending the frustrating search for treatment instead of witnessing the incomparable joy of families reunited by recovery. With your support, lives are being saved tonight, but too many more lives are being lost. So please help us change the scales. We are so very thankful for your support. It's easy to lose sight of the problems of addiction amid a pandemic, but Shatterproof is very grateful to hear now from a man who is laser focused on both of them. David Solomon wears many hats. He's the Chief Executive Officer of the Goldman Sachs Group. He's on the board of trustees at Hamilton College, and he serves on the board of the Robin Hood Foundation as well. This evening, we are proud and we are grateful to introduce him as DJ D-Soul and a member of the Shatterproof family. The two are linked. Mr. Solomon is supporting Shatterproof through the record label that he started, proceeds from which are focused on the addiction epidemic. Ladies and gentlemen, David Solomon.
Thank you, Craig, and thank you, Gary, for inviting me to join you this evening. I know that today marks the 9th anniversary of Brian's passing, which must be so hard. However, it's through that tragedy that Shatterproof came to be what it is today. I first became aware of Shatterproof when I was introduced to the organization by a college classmate of my daughter, Carrie. I was interested and impressed because I've become attuned to how big an issue and how important an issue addiction is. I am constantly impressed by Shatterproof's efforts and that of the broader team to reverse the addiction crisis in our country. This year has been tough for many of us in ways we did not anticipate. This is, and we are experiencing, a very significant health crisis, which has had an unbelievable impact globally, on families, on communities, on small businesses, and on our economy. Thinking back to March, normalcy as we know it came to a halt. Our country has experienced extreme job loss. Businesses have been shuttered, and the mental health of the country has been seriously challenged ever since. Even before the pandemic hit, this country was already facing the devastating public health crisis of addiction, which has material consequences. In 2018, more than 175,000 deaths in the United States were related to alcohol and other drugs, which is the third largest cause of deaths in our nation. Many of those deaths were from an opioid overdose. In fact, fatal opioid overdoses in the US were roughly 47,000 in 2018. And this year, as Craig mentioned earlier, cities are already reporting an increase in overdose deaths. Not only does the addiction crisis affect countless lives, but it also has a massive economic toll on society. It is estimated that the total cost to society due to the addiction epidemic has ranged from $179 billion to almost $700 billion in 1 year alone. These impacts are felt across a broad swath of society, from healthcare to employers to the government. Yet thanks to Gary and Shatterproof, there are solutions to reverse the crisis caused by addiction. And these solutions are actionable so that each and every one of us can play a part. The national movement to end addiction stigma is a catalytic strategy that outlines how healthcare, the media, law enforcement, governments, communities, and employers can help reduce the stigma that is driving the addiction epidemic in this country. One of the most broken things is the treatment system, yet it is critical to have the right system to get people with this disease the help that they need. Shatterproof's plan to revolutionize the treatment system is already happening. They created the Shatterproof National Principles of Care to help patients and their loved ones understand what good treatment looks like. They also have created Atlas, the Addiction Treatment Locator Standards and Assessment Platform, to provide those in need with a way to find the type of care they need and to locate quality care. Shatterproof gives everyone a chance to be an advocate for change, especially when it comes to changing local policies and laws. In the past 6 years, Shatterproof and the grassroots advocates have been influential in 25 bills signed into law in 18 states. All of us can play a role in any of this work, and if nothing else, let's treat addiction as a chronic treatable disease, not a moral failing. When I think of worthwhile investments in America, I think of Shatterproof. They are harnessing the models of business with sure-footed strategic thinking, the rigor of science, and the power of a national movement to create change and save lives. Shatterproof is a nonprofit that I believe in and that I invest in. I recommend that you too invest in Shatterproof so that they can continue to do their life-saving work in a time when it is most needed. Thank you.
Do you worry you may have a substance use issue? Are you afraid a family member may have an addiction? Learn who is most vulnerable, why opioids are so dangerous, and how best to protect your family. Plus, a simple 1-minute quiz can tell if you or a loved one has a substance use problem. The Shatterproof Just 5 Addiction Education Series answers these questions and more in 5-minute lessons. Make a difference in someone's life. See the amazing transformation that is recovery. All it takes is just 5 minutes.
Hi, Gary. I have my candle with me. It is all lit up and brightening up the world. And good evening, everyone. I met Gary Mendel when Shatterproof was in its infancy, and I was in a very dark place. I lost first a brother and then a sister to drug addiction. My brother Bill overdosed. My sister Eleanor took her life, leaving a note that said, "I don't want to live. Not like this. I'm an addict." Like Gary, I had seen treatment fail them time and time again. And truthfully, I didn't think anything could be done about the disease of addiction. And even more truthfully, if I have to admit it, I didn't much care. I turned inward and became very bitter and despondent and depressed and sad. Then I met Gary, and over time have come to realize that we are two very different sides of the very same coin. I couldn't imagine anything could change. He couldn't imagine a world where something didn't change. I joined Shatterproof's board of advisors and have since watched in wonder. Shatterproof has become a galvanizing force on behalf of those who suffer the devastation of the disease of addiction and their families. Gary has found ideas that are proven to work, and Shatterproof has championed them forcefully and relentlessly, program by program, state by state, person by person. Through all of the events and programs that you've seen tonight, Shatterproof is giving voice to the silent sufferers of substance use disorder. Before Shatterproof, the silence around addiction wasn't just deafening, it was deadening. And now that silence has been shattered for good. So I hope you'll join me in supporting this awesome organization, which has made a believer out of me and so many others. I've had a front row seat as a man had the courage to change what he could. And he did. We can do this. Shatterproof can do this. All it takes is all of our belief and all of our help. Thank you.
It is now our pleasure to introduce a woman whose soul and music are so full of heart, you may want to have your hankies handy. Singer-songwriter Sarah Mclaughlin, a Grammy Award winner and head of the Sarah Mclaughlin School of Music in Vancouver, which provides free music education to at-risk and vulnerable youths from toddlers to high schools. And she has given her time and talents to many charitable causes, most recently on behalf of the first responders and victims of COVID-19 in her home country. And like so many of us, she has also seen the devastation addiction can have on our loved ones. Ladies and gentlemen, Sarah Mclaughlin.
Thank you, Craig, and thank you, Gary. I am really honored to be performing here tonight for you and Shatterproof tonight. I want to thank everyone who supports this cause and who is working towards ending addiction stigma. Even though we're not together in person, we are together in spirit and solidarity. So I want to start out tonight with a song that I wrote after reading about Jonathan Malvoyan, the keyboardist from the Smashing Pumpkins, who died of a heroin overdose. I had been on the road for almost 2 years straight and was both mentally and physically exhausted, and Jonathan's story shook me to the core because though I've never done hard drugs like that, I felt a flood of empathy for him and that feeling of being lost and lonely and desperately searching for some kind of release. So this song is for him and all the lost souls seeking comfort and peace. This angel. Spend all your time waiting for that second chance, for the break that would make it okay. There's always some reason to feel not good enough, and it's hard at the end of the day and needs some distraction. Oh, beautiful release. Memories seep from my veins. Let me be empty, oh, weightless, and maybe I'll find some peace tonight. In the arms of the angel, fly away from here, from this dark, cold hotel room, and the endlessness that you fear. You are pulled from the wreckage of your silent reverie. You're in the arms of the angel. May you find some comfort here. You're so tired of the straight line, and everywhere you turn, there's vultures and thieves at your back. The storm keeps on twisting. You keep on building the lies that you make up for all that you lack. It don't make no difference escaping one last time. It's easier to believe in this sweet madness, oh, this glory.
brings me to my knees in the arms of the angel. Fly away from here, from this dark hotel room and the endlessness that you fear. Oh, you are born from the wreckage of your silent reverie. You're in the arms of the angel. May you find some comfort here. You're in the arms of your angel. May you find some comfort.
In the time of COVID-19, we know that overdoses are spiking and the isolation is hurting so many of us. We need to make sure we are connecting with each other, offering empathy and comfort to our neighbors, friends, and family, giving support however we can, letting people know that they're not alone. This is I'll Remember You.
I will remember you. Will you remember me? Don't let your life pass you by. Weep not for memories. I'm so tired, but I can't sleep. Standing on the edge of something much too deep. Funny how it feels so much, I cannot say a word, though we are screaming inside. Oh, we can't be heard. And I will remember you. Will you remember me? Don't let your life pass you by. Weep not for memories. Do it on down. Do it on down. I'm so afraid to love you, the more afraid to lose. Clinging to a past that doesn't let me choose. Once there was a darkness, a deep and endless night. You gave me everything you had, oh, you gave me light. I will remember you. Will you remember me? Dum-dum-dum, weep not for the memories.
I know that music is a conduit to our emotional worlds, and through it we feel our humanity, our joy and sadness, our love and loss. There's so much unity and connection in hearing something in a song that brings us closer to our feelings. It's really powerful. It makes us feel less alone. And I'm so very grateful that I have this outlet. It helps me feel, helps me heal.
80, I do believe I failed you. 80, I know I've let you down. But don't you know I tried so hard to love you in my way. It's easy to let it go. 80, I'm empty since you left me. Trying to find a way to carry on. Well, I search myself and everyone to see where we went wrong. 'Cause there's no one left to finger, there's no one here to blame. There's no one left to talk to, honey, and there ain't no one to buy our innocence. 'Cause we are born innocent. Believe me, 80, we are still innocent. It's easy, we all falter. It doesn't matter. 80, I thought that we could make it, but I know I can't change the way you feel. I'll leave you with your misery, a friend who won't betray. I pull you from your tower, take away your pain. I'll show you all the beauty you possess if you'd only let yourself believe that we are born innocent. Believe me, 80, we are still innocent. It's easy, we all falter, but doesn't matter. Cause we are born innocent. Believe me, 80, we are still innocent. It's easy, we all falter, but doesn't matter. Believe me, 80, we are still innocent. 'Cause we are born innocent. Oh, believe me, 80, we are still. It's easy, we all falter, but does it matter?
So not all of my songs are sad. Every once in a while I manage to write a happy one. And this is one of my very favorites. It's called Ice Cream.
It's better than ice cream, better than anything else that I've tried. Your love is better than ice cream. Everyone here knows how to cry. It's a long way down. It's a long way down. It's a long way down to the place where we started from. Do 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 do. Your love is better than chocolate, better than anything else that I've tried. Oh, love is better than chocolate. Everyone here knows how to fight. And it's a long way down. It's a long way down. It's a long way down to the place where we started from. Do 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 do. Do do do. Oh do do do. No 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 no. Do do do.
Thank you so much for listening and for being dedicated to reversing the addiction crisis. I want to thank all of you again so much for joining tonight. Your support will help Shatterproof continue to do their valuable work of saving lives. Take care. Be well.
Wow. Sarah, thank you so much. And thanks to all of you who are supporting Shatterproof tonight. You're making this a better world, one in which fewer lives will be devastated by addiction. Thanks again to Gary Mendel, Jerome Adams, David Solomon, Edie Magnus, for their wonderful words on behalf of the organization. As Gary said at the beginning, tell everyone you know that change is coming, because it is coming, and more lives will be saved. Good night.